OBGYNs are trained to take care of two patients simultaneously. We know how to do our job really well. And I think this is just going to equip individuals and patients that may be listening to know that the life affirming approach is really an approach that's rooted in a very holistic view of the human.
Yeah, I want to reiterate what you said too. This is the important part about caring for both patients and also our continued, main point of advocacy. Okay, welcome back to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or also known as AAPLOG. On this episode, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Jordan Butler, the Communications Manager for AAPLOG. So this is actually the last time that you're ever going to hear, at least last podcast episode, you're going to hear that intro, because today's episode is kind of a bittersweet one because we are sharing that we are closing down this series, Caring for Both. However, that comes with another exciting announcement that we are launching a brand new podcast. While we're going to miss Caring for Both, and we'll talk a little bit about that, we're really confident that you're going to love our new show that's going to be coming in 2 weeks. So after this podcast episode, we'll take a break and then we'll jump right into our new series, which is called Observations, an open, thoughtful conversation on women's health. And so for this podcast, each week, we're going to dive into real stories, real science, and real questions that are going to be shaping women's health today. We're going to be bringing together clinical insights, lived experience, aligned perspectives, and also respectful disagreements. So we're going to jump into that a little bit more with Dr. Susan Bane, who has been a regular host of this podcast and will continue to be for Observations. She's also the AAPLOG Chair. She's going to talk a little bit about this exciting transition. We're also going to give some really fun updates on MBEC, and then we are going to talk a little bit about the Pro-Life March, which by the time this episode comes out will only be a day out from the march. So Dr. Bane, thank you once again for being here.
Thanks for having me, Jordan.
Yeah, always. And excited to keep having you for our new podcast. So let's just talk about that real quick, because there might be some questions wondering, what's happened, what kind of inspired Observations and how is it going to look different? And I know that this is going to actually kind of be more of an open conversation between you and I.
Yeah. Well, I have to first give a shout out to you for coming up with the name because it's observations. So I think that's pretty darn catchy. And I think when you think about how it's going to be different, observations and conversations are similar words. And I think this is going to try to be very conversation based. And we need that in our society. I think open-ended conversation really encourages active listening. It encourages deeper thinking. It requires us to be creative, to actually push back on each other a little bit, make ourselves have to defend our positions, hear ourselves say things out loud. And so I think from the standpoint of the format, I'm excited because I'm a talker. So I'm excited about conversation, but I also have learned to be a good listener, some days better than others. But when I reflect on what the mission of AAPLOG is, the first few words are to encourage and equip healthcare, professionals who are practicing life-affirming medicine. So how do you encourage and equip? I think this is one of the great ways that we can do that. I think when you say we want people to be able to support practicing life-affirming medicine from an evidence-based approach, you have to pull back and go, when we talk about practicing evidence based medicine, what's that really mean? And what it means is that we take the best available science, we take our clinical expertise, we take the patient in front of us who has their own perspective, values, lived experiences, and together through shared decision making, they make a really informed decision, or we journey with them together for that. So I see observations as the start of a new journey for AAPLOG.
Yeah, I agree with you. And I kind of want to piggyback off of what you said, where it comes when we talk about equipping and encouraging. And one of the things that, we see in the landscape, at least from my perspective as a more of a patient side of things, and that's kind of the fun part about observations for me is that I'll get to join for some of the episodes and offer a more patient perspective, some of the OB perspective, which is a lot of fun. But there's been a growing interest with a lot of young women online wanting to learn more about their health and not just accepting a diagnosis, but really understanding what that diagnosis is. And oftentimes there isn't, sometimes not, sometimes there isn't always a pro life voice to give that, which is exciting that we get to give that as the pro life medical voice. So I'm very excited about that, if that makes sense.
No, it
Dr.
makes
Bane.
total sense. And I see that in patients who are really trying to understand their cycle regulation and fertility, and even just understanding what they can do to reduce things like inflammation in their body. So, really trying to take a root cause approach. Those of us trained as allopathic doctors, MDs, a lot of what we learn is very um, drug medication prescription oriented and procedure or surgery oriented. And they all have an extremely important place. We will always need medicines and we will always need surgeries. However, there's an awful lot that can be done, from how we eat to how we move to how we sleep, our spirituality, our management of stress. And so I think what's really neat about this is when we think about life affirming medicine and caring for two patients simultaneously. Yes, preventing one of our patients for their life being ended is so important. And we will continue, of course, to advocate that death is never used as a therapeutic modality for one of our patients. I think an extension of that is a lot of women are, I'm surprised at how many women come to me who are considering abortion because they're afraid of their history of diabetes, or perhaps they
Mhm.
had preeclampsia in a prior pregnancy, or a family history of someone in their family having a complication. And so I think the beauty of what we'll be able to do here is, before a woman gets pregnant, we can be addressing issues there to gain confidence. Um, when she's pregnant, and then even postpartum. So all three of those phases. And and I OBGYNs are trained to take care of two patients simultaneously. We know how to do our job really well. And I think this is just going to equip individuals and patients that may be listening to know that the life affirming approach is really an approach that's rooted in a very holistic view of the human.
Yeah. Want to reiterate what you said too. The important part about caring for both patients and also our continued, main point of advocacy, which is for the preborn child, in the womb that is taken away by the brutality of abortion. That's so important to talk about. But when it comes to empowering, one of the things that the abortion industry tries to tell women is that abortion is empowering. But with a holistic approach, what you're saying here, Dr. Bain, that's actually much more empowering to understand how your body works, to understand, when medicine is necessary. And then maybe perhaps if there's other, holistic changes that can be made, that would also be helpful. I think that that is a much more pro woman and pro baby approach. And one of the fun things too, I think about this podcast is we're also going to be maybe bringing in some different voices, having respectful disagreement, which I think is something that is so needed in our society and something that blog, and I think our CEO, Dr. Christina Francis, has said this, having respectful and civil dialogue. And I definitely hope that this podcast can do that.
Yeah, I can remember in my years of training on rounds and in educational conferences, some pretty heated discussions that were all meant in the spirit of science. Um, Science is about observing, and it's about testing hypotheses, and it's about replicating those hypotheses. It's not being settled with what we know, but having that ability to say, wow, we thought this was right, but now we're not sure. So, for example, in our field, we thought once a C section, always a C section. We know that's not true. Many women want to experience a vaginal birth after C section. In the right situations, they can. We used to do episiotomies routinely, thinking we were protecting women from rectal injuries, and we found out we were actually making it worse. And so I think the idea of never thinking that science is settled, because it's not, um, and being able to push back against each other. I used that phrase a little bit before, but there is absolutely nothing wrong with saying, hmm, I, I want to ask you this. And I read a study the other day that said that. What do you think about that? And the person maybe doesn't know, but he or she goes and reads that study, and then the conversation continues. So, you know, we want to have hard conversations.
Yeah. And I think, and also just what's cool about this for, someone, I'm not a doctor, is some of the guests that we have lined up, which I'm really excited about.
Me
As
too.
kind of the producer of the podcast too, I get to listen in, before everybody else gets to hear it. And it's just it's going to be cool to kind of listen into a bit more of a high level conversation, like that's going a little bit deeper than just kind of like your, Wikipedia. Not that there's anything wrong with that, but like just going into depth with it a little bit more. And that's going to be exciting if you like to kind of nerd out in that way. So I'm really excited about this podcast. Hope you guys are excited about it too. I think you guys are really going to like it. So I won't spoil too much more, but you are going to be seeing a lot more over the next couple of weeks. I'm very excited to share it. But let's have a little bit of a moment for caring for both, because it's yes, it's going away, but there's still going to be elements of it that are going to be very much alive in observations. I am kind of curious, Dr. Bane, because you've been here much longer than I have. What have Can you just like maybe name like maybe one or two conversations that you thought were really interesting over the past couple of years?
Yeah, I learned so much from listening when Dr. Francis hosts, or learning when I host and get to talk to people. I think, we have clinicians, we have patient voices, then we have people that are outside of medicine, policymakers, legal experts, so there's a wide variety of them. I did get the honor of meeting Leslie Wolbert, who used abortion drugs with no informed consent, with little to no ongoing medical care. And the hurt that she experienced as she was alone, was, as she will say, with nobody to turn to help her, um, and how that has impacted her, but also how she's healed from it and is now using her voice to advocate for women. Um, that one brought the reality that I see in my work in 4 pregnancy centers across North Carolina to light. Um, I, I'm a little biased, but I have a good friend I was fortunate enough to interview. His name is Dr. Greg Murphy. He's also Representative Greg Murphy. He is in our United States Congress. He and Senator Langford have put forth a bill um, to protect the conscience rights of medical residents. I have a particular heart for the next generation. I was trained so well at the University of Illinois and East Carolina University, and I was trained in ways that were life affirming. Two public institutions that taught me how to practice medicine in a life affirming way. And I was not forced to do abortions, I was not coerced into them. I could opt in, but now the environment is opting out with an expectation you will do them. And it's a very coercive situation. We've spoken about it before on our podcast, but the fact that you have policymakers um, they care enough and recognize this situation and are trying to protect the conscience rights of the next generation, um, that is really important to APLOG and to me personally.
Yeah, and we're looking forward, to hopefully seeing this bill go forward for sure.
Mhm.
And if you guys want to watch that episode, we'll make sure to link it in the show notes below. But yeah, I know it's probably hard to choose because there's a lot of you guys have had a lot of fantastic uh, guests over the past couple of years. So I'm gonna do a hard transition though because we want to talk about a couple of things before we wrap ourselves up here. We have MBEC 2026 coming up. That's going to be in Seattle, Washington. If you haven't signed up yet, there is still time. You got about a little over 3 weeks. So we'll make sure we put registration down below as well. But tell us about a couple of really exciting updates. We talked about AppLog, really being the pro-life medical voice, and that means raising the pro-life medical students slash generation, so to speak. So talk a
Right.
little bit about how that ties into MBEC.
Yeah. So one of the great pleasures I get at MBEC is to sometime MC from the stage. And last year, when we were acknowledging those who helped send medical students, residents, other students in healthcare to MBEC, fully scholarshiped, I asked anyone in the room who had given partial scholarship or full scholarship to stand. And each year I see that room growing, but I challenged the audience. I said, when I ask this question next year at 2026 MBEC, I don't want to see a single person sitting. And we're getting close to that. We actually have fully funded at $2,500 each. 54 students have been approved for MBEC for 2026. We have 16 who have applied and who are waiting for funding right now. So if you go 16 times 2,500, that's $40,000. We are looking to raise an additional $40,000 to get all those students there. It's so fun to see them. They're so eager to learn. They're so eager to have that networking opportunity, not only to connect with mentors, those of us who've been practicing for years, but their own peers. Because sometimes you'll have a student coming from a school where they really feel like they're the only student who wants to practice in a life affirming approach, even though we know there are probably a lot more. They just haven't got the voice yet to be vocal about it. But, we're in a point where we have all across this country, we have a shortage of OBGYNs. We have maternity deserts where women can't access prenatal care as easily or labor and delivery units. We've had this. This is not a new phenomenon. This is not post Dobbs. This is an issue, but post Dobbs has made it worse, sadly, because a lot of the students are being told, unless you're willing to do induced abortions, you shouldn't go into this field. And that is just not right. And that's wrong information, as a matter of fact. So they leave this conference questioning at first when they come about this field and leaving with so much, as we say, encouraged and equipped. That's exactly how they leave. So, excuse me. So for
Definitely
me,
talk
that's
about.
one of the most exciting things about MBEC.
Yeah, that is really exciting. And I know that for, some, if you're able to fully fund a student on your own, that is amazing. But even if you give just a small donation, that also helps tremendously. And those donations add up. So don't feel like it's too small to give. But no, that's really exciting. It's really encouraging to hear that MBEC 2026, or excuse me, MBEC in the past has really given students the confidence to be a pro-life medical professional in America. So that's wonderful. And I'll quickly just kind of throw this in as well. We have a lot of awesome sponsors that are going to be there. Uh, there's many of them, but just a couple. Heritage Foundation. We have the Alliance Defending Freedom, American College of Pediatricians. We're also going to be doing some awesome episodes with them to talk about their work a little bit more in depth. So stay tuned for that. But jumping to the immediate of what's happening this week, which is the 2026 Pro-Life March, we are going to have a group of doctors in our white coats there with our signs representing the pro-life medical voice. Tell us something that you're looking forward to.
Yeah. So, you know, this work is hard and there's a lot of darkness in it. Not on that day. That March for Life is so energizing to first see so many people in white coats so that the lay people understand there are doctors who practice life affirming medicine. Then to see the next generation out there. It's a young crowd in many aspects. There's also a lot of families out there, but there's so much love. I think abortion represents a culture of death, and that day is a culture of life. And that's where we need to go to. Laws are needed, but we need the science, we need the change of heart for this culture to be one that considers all people our neighbor, including preborn children.
Yeah, that's exciting. And when I've been there, the energy has been absolutely fantastic. And a lot of, you're right, a lot of young people, a lot of families. And I think it's going to be really special to have AAPLOG there, everyone in their white coats with our signs. It's going to be fantastic. But Dr. Bane, is there anything else you want to say before I wrap up our final episode? So weird to say, but is there anything else on your mind?
Join us in DC Friday, or join us also at MBEC in September, or in Seattle, the end of February. And join us on our new podcast, Observations. We're excited.
I'm excited. I'm excited too. And with that, I'm going to wrap us up with the last time you'll hear this type of ending. We want to thank you for always joining us on this podcast, listening to this podcast. If you like this episode, be sure to give us a like and subscribe on YouTube. Or if you're listening on a podcast app, please give us a 5-star review. It really does help. Thank you guys so much again, and we will see you in our next series, Observations, an open conversation about women's health.